honest to God, I can't make this stuff up. But this is a song that is by it's a popular rap song by an artist named O.T. Genesis called Cut It. Have a look at this. Susan, I'd like to ask you your reaction to those videos, especially since you're representing patients who claim they have been irreparably damaged in her OR.
Thank you. Yes, we were shocked when we discovered those videos. It was very concerning to us that she did not appear to be taking these procedures that seriously. We were concerned about the sterility of the environment, that infection protocols were not being followed, just the overall atmosphere in her operating room. And I'm going to use that term loosely because these procedures did not take place in a actual operating room or a hospital or an ambulatory surgical center. These procedures are taking place in her office, in a room which she has built out as I guess somewhat of an operating room, but certainly not what you would expect in a normal surgical setting.
And I want to make sure that our audience understands we've had to digitize part of the image because we feel it's shameful to the patient who's on the table. The physician is actually shaking the person's flesh and literally cutting while singing. So it's not sort of a pre-op while the patient is being sedated. This is actually happening during the performance of the song. And this isn't the only video that there is. There are several different song and dance routines going on. Talk to me a little bit, though, Susan, about why, because the layperson in me says, well, certainly that doctor won't be, practicing now. That's not the case, right?
No, that's not the case at all, which is why my clients have voluntarily stepped forward to tell their stories because we are frustrated that the Georgia Composite Medical Board has failed to take any action against this doctor. Now, this doctor is just one example of many who in Georgia need to have some regulation on their license because these physicians are practicing well outside the scope of what they're trained and what their education entails. So it is concerning to us that the Composite Medical Board has been aware of Dr. Boutte since March of 2016. OJ's mother was catastrophically injured in February of 2016.
And I want to get to that, actually. Susan, I want to get to OJ's mother's story, but not before I hear a little bit more about the presentation of this particular doctor to her patients. Her own website and her bio that is posted says that she's board certified in surgery and dermatology, okay? But we actually looked up the medical records. And while she claims that she is certified in surgery and dermatology, the state medical records actually list her as board certified in dermatology. Susan, is that something that is a legal issue, or is that just marketing?
Well, no, that is a legal issue in terms of the misrepresentation of your qualifications to the public who are relying about what you're putting out there in terms of your qualifications and if they're going to select you to do these important procedures. There's no dispute that Dr. Boutte is board certified in dermatology. She is not board certified in surgery. That is a separate board certification by the American Board of Medical Specialties, and she has not gained that level of certification.
Okay, she's also facing 6 lawsuits to our knowledge right now. She has 4 malpractice settlements that we've been able to unearth at least, and I'm just going to go over them very quickly because they're not small. In February of this year, $1 million settlement. Also in February, nearly $1 million. In January, the month before, $95,000, and just last October, another close to $1 million settlement. Now, it is not unusual for doctors to be sued. They carry malpractice insurance for a reason, and they settle as well. So that's, on its surface, not necessarily a talking point. But I do want you to hear this one fairly ironic piece of video that Dr. Boutte posts on her site about you as a patient and what you should expect when you come into the OR. Have a look.
Smart lipo has totally revolutionized the concept of liposuction. It is a simple procedure that is done in office under local anesthesia with the patient listening to their iPod, singing along with music, and it's actually an enjoyable experience.
An enjoyable experience. Sing along with your iPod. You can be a patient and listen to music, or you can just listen to mine and maybe sing along with me. Oh, you're under anesthetic. These are the claims that are being made against this surgeon. I'm going to ask you all to stay put, if you will, and particularly OJ, when we come back, I want you to tell me about your mother. She was set to get married in just a couple of weeks. She went in for some Botox. She was convinced that perhaps maybe another procedure might be to her liking. And now you are left with a mother who needs permanent care for the rest of her life. We're going to get that story and find out a little bit more about the law, where it stands, why this physician is still practicing, and whether the American Medical Association has something to say about this. That's next.